and Presiding Officer Sherry San-Cyprian.
Aye.
Motion passes.
Great, thank you.
Mhm.
Our advisory board did not receive any requests to give public comment during the meeting, so that's the next item on our agenda that we will just pass over. The next big section will be staff reports, but before we start with staff, I just have to give a big shout out to our staff. Angelica is my guide, making sure that I know what I'm doing every time we have one of these meetings. And Katie and Erica are always so responsive to anything that I need as the board chair. And also they helped me present at the Texas Speech Language Hearing Convention this spring. We've done it before, but I think it's really helpful for members of the association to hear from people at TDLR and be able to ask questions. So I appreciate their help. And first up is the report from Katie on the licensing division. You're still muted, Katie.
Okay, I'm Katie Bryce, Deputy Director of Licensing, and I'll be giving the licensing staff report for Leonard Rivas, who is retiring at the end of the month. I want to take just a quick minute to thank Leonard for his almost 33 years of service to the state. He's been the licensing manager over this program since it came to TDLR in 2016. And for those of you who may remember when this program was at DSHS, it was not uncommon for applications to take 6 weeks or more to be approved. And under Leonard's guidance, that has been greatly reduced. So I just want to thank him and congratulate him on his retirement. You all can see the staff report. It looks like they were able to switch the corrected form. I apologize that you all originally got a report with an incorrect number on it. But you can see here that the licensing population generally is continuing to increase. We have a total of 18,998 SLPs in the third quarter. For these interns, it went down to 857 in the third quarter. That's because the third quarter of our fiscal year is March, April, and May, and a lot of people are able to finish their internship within 9 months of getting it, which they usually get in the summer. So that kind of just drops in the third quarter, but it'll pick back up once we report out the fourth quarter numbers. We can go down. The speech language pathology assistants continue to increase. They're almost all done, renewed online, which is great. That's what we want to see. And if we go down some more, the audiologists had just a real small decrease. We currently had 1,622 licensed in third quarter of the fiscal year. The audiology interns are at 72. And audiology assistants went up to 60. And I'm happy to answer any questions.
Any questions for Katie? Our numbers just keep growing. I'm not sure that our licensees really always understand that TDLR is managing more than 20,000 licensees under our umbrella of licenses. That's a lot of bodies. So thanks and congratulations to Leonard. I hope he has a great retirement. Thank you, Katie. Up next, we have Ari Acevedo, who's doing the Education and Examination Division's report.
Thank you, Madam Chair. Good morning, Advisory Board members. I'm Adi, and I will be presenting the Education and Examination statistics this morning. As you can see, we have the jurisprudence examination numbers. We have the fiscal year 2024 in its entirety, and then we have fiscal year 2025 through June 30th. And I'm here to answer any questions you might have. Looks like the numbers will be very similar once the fiscal year is complete. If there are no questions on the jurisprudence examination, I do have an update. As you all know from our last advisory board meeting, we did begin the CE audit process. So the adopted rules allow for the CE audit to occur after license renewal process so that the CE review will not delay any license renewals. It's meant to be an easier process for the licensee. E&E's audit and policy team, we worked closely with IT to ensure that this project went live January 1st of this year. And as you all know, a random selection of SLPs, SLP assistants, audiologists, and audiology assistants were all sent audit notices on May 19th of 2025. And the due date for sending in the required 20 hours of CE, which includes the 2 hours of ethics and the 1 hour of human trafficking awareness, is November 18th, 2025. And we want to make sure to thank everyone who has already complied and gone above and beyond and sent in their continuing education information already. Thank you.
Just something that we probably need to be really clear on our messaging. The 20 hours of continuing ed, the way this is written, includes the 1 hour of human trafficking. But our
Yes.
licensees need to understand that that is not continuing ed that they can count toward their if they have another credential. So if we're counting that within the 20 hours, I don't think that's clear to everybody that the 20 hours includes that 1 hour of human trafficking. So therefore, you need 19 hours specific to your profession. Is that correct?
Gotcha. Yeah, that's how we've been counting it. You are correct, ma'am.
Okay, so that's just probably something we can do as we are as advisory board members as you're talking to people, because I'm pretty sure, and I see Judica nodding, that people think that it's 20 hours plus 1 hour of human trafficking.
And that's what we've been seeing. We've been seeing 20 hours or more. You guys love to go above and beyond, you guys are with your education. And then we see an additional human trafficking here and there. So I understand that. Yeah.
Yeah, I think most people probably just in their head are looking for 20 hours specific to either speech pathology or audiology, including the ethics, but then also do human trafficking separately. So, okay, anything else for Ari on education and exam?
Miss Katie Bryce has some
Yeah.
information for us from licensing.
Yeah, I just wanted to make a clarification that this work group did meet to discuss the human trafficking, and they determined that it was not going to qualify for continuing education. So it is in addition to the 20 hours.
Okay, that's exactly what I wanted to clarify, that we still need to be saying it's 20 hours of continuing ed in your profession plus an hour of human trafficking. And we just need to be really consistent in that messaging.
Okay, wonderful. Thank you. I'll take that back to the team. I appreciate this.
Great. Any other questions for Ari? If not, we can move on to the customer service division. And today it's Patricia Martinez Castellan who's representing that division.
Good morning, advisory board members. I'm Patricia Martinez Castellan. I'm a manager here in customer service covering our stats for today. Looking at fiscal year 2025 from September through June, we handled between 1,358 and 2,205 customer service contacts per month. With a peak in January, the majority of contacts continue to come in through calls, with emails making up a smaller portion. Comparatively, in fiscal year 2024, monthly contact volume ranged from 1,483 to 2,537, with the highest volume seen in August. Email volume was also higher last year, averaging about 450 per month. Overall, we're seeing a downward and steady trend in total contacts in FY 2025 and continue working on a first come, first served basis to continue assisting as quickly as possible. We also have 5 new hire customer service reps onboarding, so we look forward to their contribution. That concludes our statistic report if anyone has any questions.
Hopefully that downward trend reflects that we're getting good information out to licensees and they have fewer questions. But Patricia, do you guys keep statistics at all about how promptly one might expect a response to an email inquiry?
It really depends on the nature of the inquiry. As I stated, we do work them first come, first serve, unless it's, an escalated case. But we do work very closely with the licensing team, and they're really great at also getting us some more additional information, whatever the case may be, to respond as quickly as possible.
Okay. Any additional questions for customer service? Okay.
Thank you.
Good. Thank you, Patricia. Enforcement Division, Shauna Almashuk.
Good morning, Advisory Board members. My name is Shauna Almashuk. I'm a prosecutor for the Enforcement Division, and I'll be presenting the report for you today, covering key statistics and case highlights. As you may recall from the last meeting, at the top you have the division's performance measures, and then the next section is the criminal history review for applicants who may have disqualifying criminal history. As you can see, there's a continued trend of increased applicants with criminal history this year, but that has resulted in fewer cases being opened compared to the 7 opened last year. The next section details where the Enforcement Division's complaints come from. And then the top of the next page puts that into a pie graph chart for you. And as you can see, a majority of the complaints come from the consumer. If we jump down to the bottom of this page, you can see that there are no licenses that have had sanctions so far this year compared to the 1 license suspension from last year, which is great news. And then at the top of the next page, you can see that the cases closed without disciplinary action still seem to fit into the same categories as fiscal year 2024, with insufficient evidence remaining as the leading reason for a complaint being closed. And then finally, I've added 2 case highlights to your packet to provide an example of complaint cases that were resolved by department staff, if you care to review that. I'm available to answer any questions that you might have.
Thank you for including the top allegations. That's just helpful when we do training, continuing education for our licensees about these are areas to just be aware of that, and you can make some mistakes that will cause a problem for you. So I think that's helpful. Other questions about our enforcement statistics? Just it looks like we're a pretty well-behaved group overall. That's good news. Thank you, Shauna.
Thank you.
And the Compliance Division, and Erica Rodriguez is going to present that report today.
Hi, good morning, Presiding Officer and board members. My name is Erica Rodriguez, and I am in our Compliance Division. I'll be providing the staff report for today. So I'll go ahead and begin with our current projects. So just recently, our staff has been assigned to bill implementation teams, and we're beginning implementation work for the medical and health related bills that passed the 89th legislative session. We also just recently facilitated a standard of care work group meeting and a joint work group meeting. We'll actually have some more information here in a moment. Our presiding officer is going to go over our report. We did have some great collaboration and some great ideas during those work group meetings. We also are continuing to assist other divisions with questions as well as addressing daily industry questions and emails. And then we have been involved in the development of our new licensing system. We're working with a contractor, CGI, and it's going to replace 8 of our licensing systems with just 1. It's a huge project, but the improvements ahead will definitely be worth it in the future. The outreach, we continue to work on our Health Monitor newsletter. The most recent edition was posted in June. You can find that on our website. The next edition will be coming out in October, so we strongly encourage you to sign up for the email updates if you're not already signed up for them. Also, I gave a virtual presentation to Baylor University graduate students on July 9th. I love being able to give presentations and provide them with licensing information and walking them through the process. Also, we attended the Texas Speech Language Hearing Association conference, and Katie and myself
co-presided with our presiding officer. That was in May. Thank you for having us there and being able to present with you. Also, we're excited to attend our National Council of State Board of Examiners Conference. That's going to be in September, and it'll be in South Carolina. If anyone has any outreach that you would like us to attend, please contact us, and we'd be more than happy to come out or schedule that with you. That concludes my report today. If anyone has any questions, I'm available to answer them.
Erica, is there a target date for the release of the new licensing system?
It's going to be a few years, honestly.
Okay.
Probably about 3. I think it's like 3 or 5 years, if I'm not
So
mistaken.
nothing to
But
look forward to in 26 then. Okay.
no,
All right.
ma'am, no, for sure, no. But it's gonna be a great thing for our agency and our licensees also.
Great. Great. Okay. Other questions about compliance for Erica? Okay. Well,
Thank
moving right
you.
on. We've got a report from the executive office, and I think that's the deputy executive director, Susanna Holt Cutrone. Susanna, say your last name so that I say it correctly.
You did say it correctly. It's Cutrone.
Okay.
Yes.
Hopefully
Good
speech
morning.
pathologists can figure those things out, but you never know. So good morning.
Thank you. Good morning. And thank you for starting your remarks with the support for the staff. They do a wonderful job. And as you said, I do oversee the Regulatory Services Division. So I work with Shauna in enforcement, Erica in compliance, and I also have field inspections under my purview. A legislative update. We had a terrific legislative session. There were 2 bills specific to your industry that Erica briefly mentioned with regard to the bill implementation teams. Senate Bill 912 relates to several different health programs, and it establishes a continuing education tracking system accessible to licensees, continuing education providers, and TDLR. And it does require TDLR to check continuing education and audit prior to renewal. This takes effect in 2028. So there's a bit of a runway for that particular piece of legislation. And then the second bill passed out of the Senate, Senate Bill 905, relates to speech language pathologists and audiologists in that it removes provisional licenses, which are no longer necessary now that applicants can take the judicial exam at their convenience without a waiting period. It also removes the requirement that only physicians specializing in ear diseases may authorize the purchase of hearing instruments for minors. And it instead allows any licensed physician to sign the authorization statement. It allows TDLR to consult only with the relevant advisory board on hearing instrument rules, rather than mandating it consult with advisory boards for both speech language pathologists and audiologists and hearing instrument fitters. In addition to that, as you all are likely aware, TDLR is transitioning the programs from the Texas Lottery Commission into TDLR. We have hired a transition project manager, a special counsel, and a transition director to move those programs over. This transition will not impact the programs such as yours and the technical assistance, compliance, and enforcement activities that we support. And the agency looks forward to welcoming our fellow public servants to TDLR on September 1st and is focused on its ongoing commitment to its 38 regulated industries, as well as this transition. If there are any questions, I'm happy to answer them. But if not, that ends my report.
Any questions for the executive office? No? Well, thank you for your report, Susanna.
Thank you.
Up next, Chris Funderburg, our Assistant General Counsel, is going to review the recommendations of proposed amendments. They've gone through the process and they're back to us for our recommendation to the commission then.
Yes, I'm sorry, can everyone hear me?
Yes.
And hopefully you can see in front of you the Chapter 11 Speech Language Pathologists and Audiologists proposed rules. I just got to make sure before I begin that everybody's looking at the same document. So, good morning, Presiding Officer Sherry Cibrian, and to the other members of the Speech Language Pathology Advisory Board. I'm Assistant General Counsel Christopher Funderburg. The proposed rules package before you proposes substantial modifications to Texas Administrative Code Chapter 111, the administrative rules governing speech language pathologists and audiologists. Fortunately, 99% of the rule package we presented on October 29th, 2025 is the same as the version that we're presenting you today in the supplementary document, which you should have in front of you. Thus, we won't have to review the entire proposed rule package again, except to the extent that you have any questions or suggestions. This supplementary document is the proposed rules package as it appeared in the Texas Register for public comment. The published version is slightly different than the version this board reviewed in April. As pre-publication, we caught a few errors that required correction. These changes aren't substantive and were implemented to correct grammar issues, ensure consistency between the existing rules and the proposed rules, correctly cite to proposed rules, and to conform to the style requirements of the Texas Register. Now, even though the differences between the April rules package and the published rule package are relatively minor, it's important that we notify you and the public what and where they are. So I'll review those now. So first, the rule package you reviewed in April had a few grammatical errors that were corrected in the public version. If I were to show you these individually, we'd just be flipping around this document. So please, you don't have to trust but verify, but I'll give you the page sites in case you want to check the actual grammatical corrections. So on 11130C2, there's a missing comma after November 10th, 1993. This is on page 5. We added that. There was another missing comma on 111.40C2. That's on page 9. We added that. On 111.52D18, there was a period missing after, quote, without the supervisor's signature. On page 26, we added that. On 111.90B4, there was an and that should have been struck. This is on page 37. It's now been struck. And on page 111.160F1 and 2, there was a period missing after $75. This is on page 44, and we've added both of those. Now I'll move on to the published, and this I think is, I won't say substantial, but important enough that I want to bring it to your attention. So I'm just going to scroll down to the definitions section, new number 21. You'll see that under the definition of fitting and dispensing hearing instruments, in the published version of the rules that you'll see here, prescribed, ordering, or authorizing the use of hearing instruments. This language was actually struck in the published version. However, this language actually mirrors the statutory definition of fitting and dispensing hearing instruments. So when we submit the proposed rule amendments for adoption, we're actually going to be adding this back in. There was a dialogue between the Texas Register and the department that I think has been resolved, and this is actually statutory necessary language that will be added back into the rules package when we propose it for adoption to the commission, knock on wood. So moving on, there were a few subsections in the April rules package that had missing text or incorrect text. I'm going to scroll down to .55B6, excuse me. And apologize for the dead air, but as you may have noticed, this is a substantial rules package. Let's see. There we are, and more substantial than I remember even. Okay, so if we look at what B6, you'll see that that there was a there was text proposed that the clinical deficiency plan to obtain the hours lacking, it was initially not identified as new text or text, and so we've added it. So we've struck that from the existing language. Again, these are minor changes, but they are changes from the rule package that you initially reviewed. So we do want to bring it to your attention. Now, if we look at page 33 at 111.81, excuse me. Look at C1. Initially there was language in there, the auditory intern plan agreement supervision form. This language was not struck in the initial in the April rules package. We've struck it as per the Texas Register's suggestion. Now moving on to 150. I'm just going to there was some the telephone number. Initially, there was this word right here, telephone, was not included into the struck language. We've added that back. So again, just a minor change, but something you need to be notified about. Really, the only change that I would call probably something that we need to bring to your attention is in 111.55 B5. Initially, and you'll in the published version of the rules, you'll see that there was a citation error here. Initially, the rule that as it was reviewed by you cited to a 111.50 A3. This is language that was actually struck. So we've inserted a new citation that correctly identifies the applicant requirements 111.50 D. And also there was a minor change here where again, a statutory correction is cited to 4 when it should have cited to 5. So those are the changes between the version of the rules this board reviewed in April and the versions of the rules that were published in the Texas Register. Now I'd like to review the public comments the department received during the public comment period. The public comment period began the day the proposed amendments were published in the Texas Register, that is on May 15th, 2025, and then closed 30 days later on July 7th, 2025. Rather than go through the additional complications of trying to share the comments that were included in your board documentation, I'm just going to continue my presentation and allow you to review those comments at your leisure. So during that period, the department received 4 public comments. 3 comments requested rule amendments, and the substance of the remaining comment was not related to the reviews under review. First, I'll summarize the 3 comments that requested changes to administrative rules. The first comment requested the department change 16 TAC Chapter 11, the 111's supervision requirements, without specifying which requirements should be changed or what should be changed. The department cannot implement this request as comments lack sufficient specificity to allow the department to add, repeal, or amend Chapter 111's supervision requirements. Thus, the department did not make any changes to the proposed rules as a result of this comment. The second comment requested that the department not repeal the clinical deficiency plan option for speech-language pathology assistance. The clinical deficiency plan option is currently authorized by 111.50E, but would be repealed by the proposed rule amendments. The department disagrees with this comment, as at our April 29th meeting, this board agreed without discussion to repeal the clinical deficiency plan option. Thus, the department did not make any changes to the proposed rules as a result of this comment. The third comment requested a variety of changes to proposed administrative rules. The scope of the changes requested is broad and implicates a variety of licensing and supervision requirements. In general, the comments requested changes that would either require statutory changes to implement or would modify requirements this board already discussed and approved during our work group meetings, and also discussed and approved during our April advisory board meeting. Thus, the department did not make any changes to the proposed rules as a result of this comment. Finally, I'll summarize the one comment not related to the rules under review. This comment requested that the department provide clarification about the supervision requirements for assistance in speech-language pathology, specifically regarding client contacts as delineated in 111.51F. The department cannot implement this request as the comment is not related to the amendments proposed by this rule package. Specifically, this rules package does not change substantive language of .51F, and the changes proposed will require research and discussion by both the department and this board. Thus, the department did not make any changes to the proposed rules as a result of this comment. So before I conclude, I think it's appropriate to recognize that navigating a rule amendment of this size and scope isn't easy, and it wouldn't have happened without the hard work and diligence of both this board and our dedicated TDLR staff. Almost all of the rule amendments were originally drafted by Senior Assistant General Counsel Wendy Pello, with the assistance of members of the Speech Language Pathology Work Group and our Compliance and Licensing Division. Also, the efforts of our rule coordinator, Monica Nunez, and senior legal assistant Vanessa Vasquez were crucial to ensuring the entire rule package was finalized and into a form ready to be adopted. And that concludes my presentation. If you have any questions, I'll do my best to answer them. Once we're done, and assuming that the rule package isn't substantially changed by this discussion, I'd like to ask this board to make a motion to recommend adoption of these proposed rule amendments by the TDLR Commission at their next available board meeting, August 21st, 2025.
Not a question, Chris, but I'm not sure if it was you or just other staff that were responsible. But I think the information that came out through, I think it was the health monitor, was really clear. Bulleted the list of changes because most of our licensees get lost trying to read the actual document that you just showed us.
Oh, yes. Imagine that, yeah.
That was such a good document. And I got lots of questions from it, people just wanting to verify that they understood. So, and then the first feedback that we received, the person who asked that we not do away with the CDP, I think that just tells me that we're going to need some messaging to our licensees to help them understand that they still can go to work. It's just that they'll be completing those hours under the direction of the person at the place they're hired. And I think that person misunderstood and thought there was no option for completing those missing hours. And that was the true concern, not protecting the CDP, but just some method. And the method still exists, and an easier method at that. So.
Our compliance division does a really good job of forward-facing communication of these kind of changes, and I'm certain that they're listening, and we'll probably make sure that that concern is addressed, and probably in an email blast.
Yeah, I think that can just go out to help people. So kudos to whoever did all of the editing to find the commas and periods and all the tiny that were wrong. So do any board members have questions for Chris about this updated version? It's been through the entire process. We've seen it more than once before.
This is Elizabeth Sterling. So first, I want to thank you for all the work that your committee did. And as you said, noticing all of the grammar as an English teacher at heart. I appreciate that. And so I move to accept the changes that were proposed.
Thank you.
So we have a motion from Elizabeth to accept these changes, and therefore we will be recommending to the commission adoption of these rules as presented to us today. And do we have a second?
A second, Sharice Andrews.
Sharice, thank you, Aunt Sharice, for being able to get to join us and being just in time to second that motion. So we have a motion and a second.
Ms. Cyprian, unfortunately, I can't take Ms. Andrews' second. I can't see her. So the public can't see her either. So I'm gonna need a second from I'm sorry. I'm gonna need a second from somebody else.
Thanks for the try.
Raised her hand.
I did see Judica raise her hand. Yes. Would you like to second that motion?
Okay. Well, I've been in contact with Sarah. So I second it if we need to.
Okay.
I don't know if you can hear me.
I can. Thank you.
Great. So we do have a motion and at least one second.
Yes.
So, Angelica, would you manage the vote for us, please?
Chevelle Bryant.
Aye.
Dr. Ana Maria Montanez. Elizabeth Sterling.
Aye.
Judica Maida.
Aye.
And presiding officer Sherry Cyprian.
Aye.
Motion passes.
Great. Thanks for all the work on that, Chris. That's a big accomplishment to get through such a big chunk of rules. So that's huge and to celebrate, and thank all the staff who participated in getting it to us.
It's hard work, but it's worth it, and we couldn't do it without the assistance of this advisory board. So thank you.
Next on our agenda, we have two standard of care two work group reports. The first one was a standard of care work group that met on June 12th, 2025. And the topics that were discussed were one, the Accreditation Commission for Audiology Education to consider adding that to our rules. We also discussed a cap on caseload in public schools, as that had been a common request of licensees, and then ethics and accountability related to the use of artificial intelligence. So the first thing the group discussed was the ACAE accreditation as one acceptable accreditation in our rules. However, that's not just a rule change, that would be a statutory change. We would have to go back to change the law. So TDLR is unable to move forward at that time. There were 2 bills that were filed during effective committees. So at this time, there's no change that we can make regarding ACAE. The second topic for this work group was the cap on caseloads in public schools. That's a common question and concern of people, of our licensees who work in the schools. But the work group concluded that this issue does not really fall under the scope of our licensing authority. Caseload limits that have been established in other states have been done so through administrative rules tied to the state's education code, and they're set by whatever their state agency is that would be akin to our Texas education agency. So the work group recommended that any discussion about caseload limits be addressed through the appropriate channels rather than through licensing channels. So we can hope that we can educate members, but they need to go to the education agency if they are looking for that kind of a change. The third topic that we discussed is ethics and accountability related to artificial intelligence. That obviously in the past 2 years has become a big thing that we talk about and some of us use every day, and potential ethical concerns that arise from its use. That's something that our professions need to consider. The group agreed that this is timely and an important issue that aligns with the board's mission to protect the public. To proactively address these concerns and help safeguard both clients and licensees, Chris Funderburg has been drafting proposed rules. They've come back to the work group and we've provided feedback back and forth. So we do have a draft of rules related to responsible use of AI in professional practice. Those new additions will be based on current drafts that are also underway for the Behavior Analyst program, and both just provide some boundaries, some guide rails to ensure that the human being is the ultimate decision maker for our services in just using AI as a tool. So more to come on that. Chris, was there anything else from that work group that you wanted to mention?
No, thank you, Madam Chair. I think you've given an accurate and succinct summary of the issues that we're dealing with. I hope the rule draft that we have is, I'm sure as we get feedback from the public, we'll refine it further. But I think I think what we have is a good basis, at least, for providing some sort of ethical, as you say, guardrails for the profession. I raised my hand because initially I requested that this board recommend for adoption the rules, the proposed rules, as the changes. So there have been several changes, or at least one change made to the rules as published. I would like to instead, if I could ask you to make a second motion to, excuse me, let me get the exact language, to adoption with the changes to the published version of the rules, not the proposed version of the rules.
Okay, so that information was included in your board packet, and at this time we need to entertain a motion to accept the version. I'm sorry, say the wording that we need.
Yeah, the published version of the rules.
The published
with changes to the published version of the rules. There we are.
There you go.
So
Anyone? Smart, Chevelle.
try to repeat the language, but so moved.
Yes, and is there a second?
I second.
Okay. Elizabeth Sterling. Thank you. Any discussion? Angelica, could you help with the vote, please?
Yes, ma'am. Chevelle Bryant.
Aye.
Dr. Ana Maria Montanez.
Agree.
Elizabeth Sterling.
Aye.
Almeida. Excuse me.
Aye.
And presiding officer Sherry Sensip.
Aye.
Motion passes.
Thank you.
Great. Thank you. We had a second work group that met. This is the Joint Rules Work Group. The people who met were Sharice Andrews, Kristen Culp, and Stacy Poteet, and with representatives from the Fitters and Dispensers Board, Lance Brook, and Amy Trust, along with staff Anna Clark, Chris Vanderberg, Erica Rodriguez, and Steve Uger. The Speech Language Pathologists and Audiologists and the Hearing Instrument Fitters and Dispensers Joint Work Group met on June 24th, 2025 to address an administrative rule change requiring licensees to notify clients if a hearing instrument is locked. The topic was raised during the previous advisory board meeting held on April 29 and has also received federal attention. So the work group discussed adding language to TAC 112.140, requirements regarding the sale of hearing instruments, which would add a supplemental section to the contract informing the purchaser that they are purchasing a locked hearing instrument. The additional language would require the owner to assure each client purchasing a new hearing instrument or a change of model receives a written contract that discloses the following. The hearing instrument is classified as locked, the definition of what is a locked device, and disclosure language that the hearing instrument contains proprietary software and that this proprietary software will require the owner to return the hearing instrument to the original manufacturer or network affiliated clinics or providers for all repairs, replacements, or adjustments. Adding this supplemental information will align with our board's mission to protect the public by making them aware that they are purchasing a locked hearing instrument, which they may only take to the original manufacturer or network affiliated clinics or providers for repairs, replacements, and adjustments. Chris Vanderberg, our Assistant General Counsel, was assigned to this program, and he will begin drafting proposed rules. And the draft will simplify language to ensure that it uses plain language and consistency in terms. So we can anticipate that those rules will come to us sometime in the future. Any questions, comments about that work group report? No? Okay, we are up to item H, recommendations for agenda items for the next board meeting. I just attended a meeting for board chairs last week. We met with the commissioner, and he did charge us all to have our boards be thinking about new blood, potential people that we could recommend as advisory board members. So I think that's just something that if we have ideas about that, be thinking. It's difficult to seat members on an advisory board. Not everybody wants to do this job, even though now it's mostly on Zoom and you're not paying your own way to a meeting in Austin all the time. But I think it's still difficult. So I think that's one item that we should put on the agenda, is just any questions or information that anybody might want to share about looking for people for the future. Another issue that came up was if we see issues and trends in our professions, please send that information to Angelica. As you know, and if you're newer to the board, you may not realize, but when we see something happening in the profession, we can't really email each other about it because of the potential for a walking forum. But if you'll funnel everything to Angelica, then she can make sure that that comes to us in a forum where we're allowed to discuss it. So one item about which I think we can do little to nothing is the new CMS issue related to our people who have any license that is lesser than a full unrestricted license not being able to provide Medicare services. I don't think that we can change that at all, but what is happening in a couple of other states is that some states are having discussions at their advisory board or licensing board level about changing it such that people who've just finished graduate school can get a full license. So I think that's going to become an issue to be discussed, because there are, hundreds of people graduating every year from our schools who are ready to go to work, but they will not, at least according to CMS right now, not be able to work in a facility where the majority of the people are funded by Medicare. So no matter what we think about that rule, I don't know that our licensure board can change it at the federal level, but we need to talk about the issue that other licensure boards are looking at changing their licensing standards for people just leaving graduate school. And then the last thing that's not really necessarily a bullet point for the agenda, but if you do see something worrisome, something that you think, I don't think that's right. For example, you see someone advertising for a communication helper under whatever name you want to call it, please do funnel that to Angelica. There are people who don't always understand that they are creating personnel positions that overlap with licensure standards, and that's really not okay. So make sure that that gets covered. And if we have several of those, that might become an agenda item. But just that's part of what we need to do, is be watching for those things and realize that the TDLR will not see all of the things that we might see out there. So make sure that that gets funneled to Angelica. So other agenda items that you'd like to suggest or consider?
And if you can't think of any right now, you're more than welcome to email me at any time. And I will keep a list of those items and make sure that we add them to the agenda, or very well could be something that we could address just via email. Like maybe if it's the statistics you want or something like that, I might be able to get it to you just in an email and not have it presented at an actual meeting. But definitely just email me if y'all have any questions or concerns or something that y'all want to see.
Angelica, I did just look down at my notes and see that I had written something to remind myself. One of the pieces of feedback that we got in response to the draft proposed rules that were out was the issue of the first contact, defining what first contact is. Our rule requires that the first contact be with the fully licensed SLP before that person is assigned to an assistant. But perhaps the rule doesn't provide enough specificity. In fact, I know it doesn't, because we get so many questions about that. Is the first contact like a 5-minute Zoom conversation with somebody? Does that count? Does the SLP have to do the testing? What does that mean? And so I think that would be another good agenda item.
Okay. And I may get with you to get some more information on that. If that's okay.
Sure.
Okay.
We'll do that.
Thank you.
Other things?
Anyone else? Again, if you think of something outside this meeting, definitely just reach out to me.
Great. And the next item on our agenda is discussion of our next board meeting. And we will wait on that because it always works best for Angelica to poll the board and give you several choices and see for which dates we can get a quorum. So just expect that we'll continue that process. Any last thoughts before we adjourn? No staff? No board members? In that case, I announce that we are adjourning this meeting at 10:55. Thank you all for being here and participating, and we'll see you the next time.